All right, so let's dive into anaphylaxis. So what is anaphylaxis? We all know what an allergic reaction is. You can see this arm here, it's got some hives. So if you're just having a simple allergy to something, whether it's a bee sting, could be a food allergy, could be a detergent, and it's only affecting one, like we're talking about, one body system, then it's considered an allergic reaction. And anaphylaxis is where it's more widespread. It's affecting more than one body system. So you could have hives, you could have some shortness of breath, you could have nausea and vomiting is also a symptom of anaphylaxis. And you could have some swelling like in the lips, the eyes, some of those areas. And if you all you need is two of those, and that's considered anaphylaxis. So basically what happens is there's a huge there's an immune response that causes a massive histamine release. And the problem with this type of huge, massive histamine release is it's is very potent vasodilator. So it just causes the body loses control of that constriction and just goes boom, opens up all the vessels. Even at a macro level or micro level, vascular too, it also allows the ability of leakage out of the cells. And that's how we get this edema into this interstitial areas, right? Into the eyes, kind of swell up the tongue. We have to be aware too of the airway. The tongue can actually be one of the ones that's going to swell up, and we can actually lose an airway, and then the airway itself can get quite swollen. So we have to be aware of that. So we got to make sure that they're doing well. Some other signs and symptoms, like I just went through them, like the swelling of the tongue, the oral pharynx is the number one thing. We want to listen to see if the chest, if they got some wheezes as well, affecting them, and we're worried about their breathing. Some swelling to their lips, and we went through those. And the biggest thing when we're treating anaphylaxis is the epinephrine. You got to get the epinephrine on right away, not Benadryl. Epinephrine is the first line choice. If it's within your scope to give epinephrine, you want to like draw out the proper dosing per your local protocol and give it right away and be able to give it every 3 to 5 minutes if needed. If the patient is already carrying an EpiPen and you're not, it's not in your scope to give Epi, that you can actually encourage the patient and help them, assist them give the Epi right away. And then if you're not an ALS provider where you can't give Epi, or you call in backup, that the person that can actually come in and start doing some Epi. And you want to transport these people to the hospital. We don't want to cancel on them. We're like, oh, I'm okay now. You give me some Epi, I'm fine, walk away. We got to worry about like a reoccurring anaphylaxis, because like you said, Epi doesn't last that long, and we don't want that to happen if they leave. So let's jump over to the board and look at anaphylaxis. I'm going to quick clean up the board. So again, it still has the same problem, right? Let's say they get a bee sting, they're allergic, they dump all this histamine into the system. It's going to cause the vascular space to open up and all this swelling as well. So what it will also do is it will actually cause the lungs to get a little wheezy, right? Because the vascular space, it's going to cause, and then because you're having trouble breathing, or if your airway, like we talked about before in the original shock blocks, that if your airway is actually blocked off or starts to partial block off, we're not getting as much oxygen in, that's going to cause problems as well. So what happens is this starts to affect the heart and the lungs. They just kind of repeat on one another. And our job as EMS is basically come in and see what we can do to block these, right? So the biggest thing we can do is give epi. So if you inject some epi, make sure you follow your local protocols. And what will eventually happen is if you catch it soon enough, these actually will fall back into place, and you'll notice that a lot of these symptoms that you saw from the anaphylaxis will start to dissipate. I've seen somebody actually to the point where their tongue was almost swollen out of their tongue, was swollen so far out of their mouth that I was worried that they're actually gonna be able to breathe, and where it looked like we might have to crike them. After 2 rounds of epi, really 5 minutes apart, it was amazing. Within 10 minutes, the person no longer had their tongue wasn't swollen, and they're actually being able to talk to us. So remember, give epi number one. And again, remember, anaphylaxis shock is just when they have an exposure to an allergen that's caused this huge immune response that releases that large amount of histamine that causes vasodilation and cellular permeability. All right, so we got one more to go. It's neurologic shock, and we'll see you in the next one.